Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you are here. And I'm also very excited to have a phenomenal guest with us today. We have Dr. Michael Sonick, who is an internationally known, highly regarded authority in the field of dental implantology and periodontology. A full-time practicing periodontist in Fairfield, Connecticut, he's also a frequent guest lecturer in the international program, the New York University School of Dentistry, and the University of Connecticut School of Dental Medicine. He lectures worldwide on the subject of aesthetic implants, periodontal plastic surgery, guided bone generation, comprehensive treatment. Dr. Sonick is also author of the Amazon bestseller, Treating People, Not Patients. Dr. Sonick, thank you so much for being on the podcast.
Thank you. It's a pleasure being here. As I look outside right now, not related to the podcast, I'm looking at a coyote walking across my backyard. So
Wow.
just no, don't see those two.
If you have a dog that you need to go bring inside, let me know.
Everybody's inside.
We were talking right before this podcast, how obviously this is the Patient First Podcast. We're very much both aligned with enhancing the patient experience, let's say. And your book is called Treating People, Not Patients. I think everybody on the podcast or who's listening is probably thinking, what's the difference between a patient and a person?
Yeah, it's a good question. And if you're a patient, what a difference if you're being treated as a patient or as a person. Patients are treated as procedures. People are treated as other human beings that you need to connect to. Medical school and dental school, I don't think there's one course on how to connect with another human being. There's not a course on human connectivity. There's not a course on hospitality. There's not a course on how to set up your office. There's not a course on hiring, not a course on decor. There's not a course on neurolinguistic programming. So all the things that make a practitioner successful for most cases, because you can have a very successful practitioner that's not very good at actually doing the procedures, and vice versa. You can have someone who is very good at procedures and may not have a successful practice because they're not good with other human beings. And so the book came out of COVID. The philosophy of the book I've had since my day I opened the practice, which is I have to serve the people that come in and that trust me to treat them. And as a patient myself, I've lost 9 teeth. I've had a bad accident when I was 8 years old. I've been in the dental chair, so I know what it's like to be like that. And I always, in my courses, I'm well known in the periodontal field for teaching implants and bone grafting, et cetera. But I always worked a ways into my courses something about the human connectivity piece, because I really didn't feel I wanted to teach someone who took a weekend course how to put an implant in without realizing, that implant's going to another human being, and that can impact them for the rest of their life, especially when I'm treating an 18-year-old. I'm treating an 18-year-old person. That implant's going to last 60 years and still look good aesthetically. Not many people think about that. And the way we're taught is we're taught by doing procedures. Like to graduate from dental school, most dental schools require you to have a certain number of crowns, surgeries, et cetera. They're not requiring you to have a certain number of great relationships with the people we serve. So the difference is really context. How do you treat those people? Are you looking at them as a procedure that you build an insurance company, which I know you know a lot about, or you treat them as a human being? And we changed the way we practice because of that a number of years ago. But most practitioners don't. They struggle with it. They struggle with insurance. They struggle with money. They struggle with that relationship piece. And there's actually a code that you can break to get through that, to connect with another human being. The thing is, most people don't realize it's important. So that's what I wrote the book.
That's obviously a very important topic. I put in my first book a thesis that I'd like to run by you, that I think there's a reason why particularly dentists, dissociate themselves from the human being that's in the chair. It's because we're doing procedures that require a high degree of specificity. We have to be perfectionists.
Right.
And we're working on somebody that somewhere between 60, 80% of the time, these people are freaked out of their minds. So we either have a short, miserable career where we absorb people's stress, or we disconnect from people and focus on doing high quality dentistry. I think that it's a big challenge for clinicians to get over. However, I think one way to get over this issue is to surround yourself with a phenomenal team that
Right.
connect with your patients. So what's your thoughts on that? Is it necessary for the dentist to have great emotion, like EQ, high EQ, connecting with people, or can they offload this to their team?
Both. It's how do you hire a team if you don't have good EQ? And that's also a problem. I haven't put it together yet, but I sometimes will go off on tangents about hiring. I can speak for a full day about that. We have a very precise process. We can talk about that some other time. I don't want to get off topic with that. But the importance, I start every one of my lectures with a picture of my team because no team, no me. All right. If you ever go into an office to treat an emergency on a weekend, you realize the importance of your team. You don't know where anything is. You have to do everything. And to be a good dentist, you need a lot of skills. In my book, I talk about I pattern my practice after running a very high-end restaurant. But the chef is not greeting people, is not setting the table, is not doing the ordering, not paying the bills. But in our office, we're doing everything. We have to be good technically. We have to be good socially. We have to run a business. We have to be intelligent to know what to do at each time. We have to manage this team. That's just 5 things that we have to do. That's a lot. So having a team around you that really does a lot of those things is important. So in my practice, and you and I both take coach where we talk about the who, not how concept, which your listeners may not be familiar with, but it's a concept where I don't have to do everything. So I have to see the patients and do the procedures. And then I do something else. I set the culture. That's what I do in my practice. But I teach everybody else to do everything else that they can. So team is critically important. I think you've probably found this when you talk to dentists. They go, I love dentistry. I just hate my team. They don't say team, they call it staff. I hate my staff. I hear that all the time. I love my staff. I love my team. But it took me a while to nurture a team around me that we can build like that. And that creates this. I think part of we're taught to do good restorations and get everything down to the millimeter, et cetera, or micron is in restorations. We're not taught how to hire a team and the importance of that. So if you go into any great organization, you'll see a great team. But there are very few great organizations. And I study that. Every time I walk into any business, I look at the team. Are they good? If they're not, then I look for the boss. If I'm in a grocery store and I ask where the arugula is, and the guy goes, I don't know what that is, and just brushes me off, I immediately look who is managing that department. And I usually see a very irritable person. So there's a store that I go to called Stu Leonard's. It's nationally known. It's a local store, but it's the largest independently owned grocery store in the world. And I asked Stu Leonard Jr., his father's passed away. I go, how do you get some good teammates? They go, they just work in the store. And what that means is they only hire people that are good teammates. And that's a very big part of what we hire. We hire based upon, are you a good teammate? Are you going to support your team? And are you servant-hearted? So those are 2 key core values that we use. Are you a serving? And are you a good teammate? And of course, do you have good integrity? So those 3 things are key in our practice. And it took a while to get there and to understand it. But the way we hire, we put people through a lot of different surveys, about 5 of them before we hire them.
As you were talking, I was thinking that right now, obviously, group practices are exploding as part of what I call connected dentistry, where there's more and more connections. Very few practices can just have one dentist within 4 walls and just stay that way now. And so practices are joining together more and more. You can call it DSO, group practice, GP, whatever you want to call it. But one thing you can't, this is a statement, a question wrapped in a statement. I don't think you can't outsource culture, right? Because like you just mentioned, it comes down to the person in the mirror, right? You can't outsource finance or marketing or whatever, but when it comes down to your team, if you're having somebody outside the walls of your practice, hiring your team, I personally don't think that you'll ever have an A-class team. Do you agree with that?
Yes and no. I do. I think you have to have somebody doing it that knows what they're doing and has a commitment to excellence. One of my role models is Danny Meyer, a restaurateur in New York. He started Unions, Square Cafe, Gramercy Tavern, Love Madison Park. He's well known because he started Shake Shack. That's how he made a lot of money. But if you go to his restaurants, the culture's usually pretty good in most of them. You go to a Four Seasons hotel, they're usually good in each one of the Four Seasons. But they have a training program that starts at the top. And to become a general manager at a Four Seasons hotel, you usually don't walk in off the street. And we need to usually work from the bottom up. So I find that works the best. An example, we had a great office manager for a while. And then she got married and moved away. She was there for 8 years. We never really replaced her. So I've been managing it with my partner. I do the culture. He does the numbers. I don't like looking at Excel spreadsheets, probably the things that you're very good at. I don't like looking at all of that, but I'm very good with the culture and making people feel good about working there. And that's what we've hired 4 office managers outside. Each one of them lasted like 2 months before the team fired them. They couldn't take it. They go, "You get rid of that person or we're leaving." So we finally it took a while, but we finally were able to find, because nobody wanted it in our team. We have 25 people. We finally hired somebody who was relatively young, and we said, "We'd like to groom you to be an office manager." And they stayed there a year. We just moved them up last week. That's working out great. They accepted her. So yeah, the culture has to come from within. You can't hire culture. What did I say? Culture eats strategy for breakfast. Culture is
Mhm.
really important, and people don't really talk enough about it. Again, we didn't have a course on culture in school. So
I personally feel like culture just comes down to the people that you hire, right? Uh,
exactly.
and yeah, I totally agree.
I can
Well,
blow my practice up in about 2 weeks by changing the culture. All I
yeah,
got to do is
and
come into the bad mood, start yelling at people. And we start every one of we have a morning meeting, which is everyone, that's very popular, morning huddle. But ours is a little different. We do the things that they all do, refute a day, et cetera. But we end every one of our morning meetings with 2 or 3 things. We tell a dad joke and somebody reads it. And then we have 2 or 3 philosophical things that we talk about. And we bring it up. We go 5 minutes on some sort of a philosophy about being a good person, about being spiritually connected, about being able to be present, to love our patients, et cetera. And then we get up just like a football team before they go out in the field, and we all put our hands together. We go beat a gift, or let's be great today. We say something very positive, and everybody leaves that office meeting laughing. And it sets the tone for the day. And we always go back for that. It's silly what we do, but it does make a big difference.
if it's silly, we do the exact same thing. We call going big, beginning in gratitude. And then every meeting ends with an inspirational quote, except on Tuesdays where we have Bad Joke Tuesday. So the only thing I'm responsible is for the bad jokes. Somebody else brings the inspiration. I think you and I have a lot more in common than I thought hopping into this podcast, which is fun.
I
Well,
don't know anybody that tells bad jokes at their meetings or spiritual things. Most doctors walk in 10 minutes late or don't go to the meeting. Meetings is crazy.
in my mind, if you're thinking of one of my favorite stories is when Usain Bolt won the gold shoes when he won the Olympics and he
Yes.
broke the world record. They talked to both numbers to the people that came in number 2 and number 3rd, the 2nd and 3rd, both broke the world record. And they went to them afterwards and said, you both broke the world record. How did you do that? What did you do to train? And they said, we're just trying to catch Hussein, right? That they were faster because of the leader, right?
Right.
And that's what I think we have to bring to our practices. Now, obviously, I'm involved in technology a lot, and there is this sort of tension sometimes between people like sticking their nose in the screen versus being patient focused. I think that technology can be used to enhance the patient experience. So, how do you think from your perspective, how can technology be used to support a person-centered approach without depersonalizing care?
Yeah. Getting a lot of things that we're doing with AI, which I know you're very much involved in. I am to a small extent. It makes it a little bit easier to garner all the information before we see the patient. And also when a new patient comes in for another practice, if we can have all that information. As a specialist, one of my biggest stressors is patients say, I don't have my records, or they didn't send it. They're not there. If there was a centralized process where we can get all that would be great. Putting together, helping with diagnosis, looking at things. I helping with writing letters, communicating with things like ChatGPT and things like that. Very few people write letters. Very few people organize information. The basics that we're taught in dental school, an exam, a diagnosis, then a treatment plan is not done. Most dentists, in my opinion, they jump right to the treatment. They go to the solution before they get the diagnostic data. So having a very organized process that is rigorous, that is run by AI or a certain process that's technological is important. And that would give the doctor more time to spend talking to the patient, connecting. As we talked about briefly, there is going to be a tremendous need as we become more and more technologically advanced and connected to the neural link or whatever it's going to be. We still need a human interaction. And we're getting away from it. It's happening. There's nothing we can do to stop it. Younger people are on their devices all the time. The number of hours a day is frightening. I don't think that's going to change. So when there's an opportunity to connect with them as a human being, then it's a true highlight of their day. People in our office are very happy. Every day I get 4 or 5 compliments from team members and also my patients. How do you have such a great team? So happy. I wish I needed, some people say, I wish I needed more treatment. I want to come back here. Who says that? It's because we're giving them a good experience that they're not getting elsewhere.
Yeah, you hit, I think, on one of the biggest issues in dentistry. It's about half of patients that get referred from a general dentist to a
Right.
specialist never even go. You probably don't even know, but that's what you're talking about is exactly what we do at Toothapps. Number one, you can share components of or the entire electronic dental record with a
Right.
specialist so that they don't have to take new radiographs, and you can look at the entire comprehensive progress note. So if there was something that was written 10 years ago about that tooth, you'll see it. And then obviously closing the loop on referrals so that you can track what's going on with the patient,
Right.
not just between general dentists and specialists, but also oftentimes a physician might get involved and we need to
Right.
plug into the EMR. And so that's like a whole nother talk show that I think is incredibly important.
Well,
And
also if the
and it
patient
sounds nerdy and technical, but you're exactly right. That's how we can treat the patient as a person. I totally agree.
yeah. And getting the patients involved too, so they can look at their records. So I have a new job now. It's medical concierge. So people are calling me all the time. How do I see here? How do I get to this doctor? Because the medical, as bad as dentistry is, medical is pretty bad too. Call a doctor's office, you get into a phone tree. You only to be told that the doctor will call you back, but you don't have any contact information for the doctor. You can't get an email, you can't get their cell phone or anything. One of the things that I do is I give my cell phone and my email to everybody. It's on my business cards, on my website. I start my lecture by giving my cell phone. It's not abused, but it's a way for people, whether they call me or not, at least they know they can call me, which decrease their stress. Right after this, our podcast, I have a doctor's appointment. I tore my retina about 6 years ago in a bike accident where I knocked out my teeth again. So I have to go once a year. And I'm seeing one of the top retinal specialists. I don't, it's funny, this is a joke. He examines my eyes, but I don't think he and I will ever make eye contact during our visit.
Wow.
He'll keep me waiting for 45 minutes. They won't apologize. I'll see 3 or 4 people before I see him. He'll walk in, he'll start talking to the computer, and then I'll put a microscope in front of my face. He'll dilate me and give me about a 30-minute bad experience of bright light going in and telling me everything's okay. And if I ask him anything personal, he'll laugh and he'll move. And he's best. He's one of the best at his procedure. He's a procedurist. He's treating me as a patient. I don't think if you asked him who I was or if he's ever seen me, he would ever know who my name was. And that's the total opposite. Why am I seeing him? Not because of a good experience, because I know he's really good. And he actually fixed my retina and it's fine. But it would be great if he also spent like, how long does it take to spend 30 seconds? 30 seconds. And I was that guy. I was a great technician and I thought I was a really good surgeon, but I didn't think I had to spend time with patients. I rushed through appointments. And now I make sure that I say to them, actually 3 times, is there anything else before I leave? And they go, no. I go, are you sure? They go, no, I'm all set. I said, well, you have my email and you have my cell phone. I said, but before I leave the room, ask me now or feel free to call me. So 3 times I will tell them and I pause and I leave. That's very powerful. It makes the patient feel great. They refer other patients and there's less complications too, because people feel comfortable that they're in the right hands. Even when I'm having a complication, they're not upset because they think, oh, you're the best. Even if I made a mistake, that they would know, but they know that I'm there for them. It's really very powerful. Can that be taught? I think so. Will it be done? I don't know. I've had a lot of doctors come through my office over the years. Most people, I teach the residents. When I start talking about this, they want me just to teach them about bone grafting. They don't think it's as important. It's more important than bone grafting, really.
I think what you just said is incredibly powerful. I think every dentist who is listening should hit the rewind 30 seconds and re-listen to that part again. I think that was a very powerful statement you just meant that you just mentioned about how you exit the end the appointment. 15% of everything is how you begin, and the other and another 15% is how you end. You
Yeah.
just told everybody how to end every visit. So if you're a dentist listening now, rewind and listen.
I'll give you the
Dr.
beginning.
Sonick, well, go ahead.
All right. Every time a new patient comes in, they're all scared. They're full of anxiety and they don't know how much it's going to cost, how much pain is going to be involved, whether you're any good, even if they think that you're good. So I always say, I know it took a lot for you to come across that door into the office. I want to commend you. I said, I'll do everything I can to help you. I said, I'm going to guarantee you something. You are in the right place. Now, when you say that declarative statements, that you're in the right place, they don't know if they're in the right place. They go, oh, thank you. It doesn't mean anything, but it does make them seem a lot more calm, and they have a lot more confidence so they can move on, because it requires a certain amount of courage for them to walk into our offices. It's a scary place.
Another amazing tip. I think it's fantastic. So obviously now everybody should go get your book. So where can people go to buy your book, to find out more?
The book is available on Amazon, Treating People, Not Patients. If you want to find out more about what I do and want some counseling or lectures or videos, you can go to my website, which is my name, michaelsonick.com. Every Wednesday, you can follow me at YouTube, which is my name, at Michael Sonick. I do a 5 to 7 minute free video on some aspect of patient care, hospitality, and I have a series of videos that you can bring right back to your office to teach your team. It's 10 modules with a workbook that you can teach your team these concepts.
Thank you very much. Your last name is spelled Sonick, Sonic, like Sonic the Hedgehog, or the restaurant chain, or like a Sonic Boom with a K on the end, a CK on the end. Go to michaelsonick.com. Thank you so much, Dr. Sonick. Appreciate the conversation.
Thank you for having me. It's a pleasure.